Hi, this is Rigesh, Managing Director of Akshaya Hospital. Basically to tell about myself, I've been in this industry for the last 30 years, close to about 3 decades, and I've enjoyed every bit of being in this industry purely because there's a huge amount of service which I felt I could continue to do in this industry. The idea was we started off from a diagnostics and then to increase our presence in healthcare. That is how we realized that we need to start an hospital. We started a small hospital which was a 30-bedded hospital in the outskirts of Bangalore, and realized there was an importance of a corporate hospital towards the northeast of Bangalore. That is how we ventured along. I partnered along with Dr. Karthik, who's a neurosurgeon, partnered along with him, and that is how we started Akshaya Neuro and Multi-Speciality Hospital. So the idea was first to have a premier corporate hospital in Bangalore, and when I spoke to Dr. Karthik and just understood his idea of having a neurosurgery setup towards northeast of Bangalore was primarily extremely important for us, because before we got into this venture, we realized that there's not a single neurosurgery setup towards the northeast of Bangalore. And we went on doing a bit of survey and things like that, and that is how we zeroed in on this place called Kammanahalli, which is literally a heart of Bangalore, to come up with this premier setup of a neuro setup. So we, of course, planning went way back in 2019, and then we zeroed upon this place because we realized that there are a lot of trauma centers and general hospitals in and around this place, but then we never found a neuro setup. So we realized that the institute should have a super specialty setup, which should be a one-stop place for all your patients' needs. And we had multiple discussions and realized that yes, this should be the place where we could give that sort of premier treatment to most of our patients. Primarily, a lot of patients would walk into a neuro hospital, and the most important part would be the cost factor. So we came up with this idea of anyone should be able to reach out to this institute and should be able to afford. The moment a patient has a head injury or something, by the time the patient reaches Nimans or Manipal or some other institute, they would lose their lives. So we realized that we could save a huge amount of lives by coming up in this part of Bangalore. Now, to describe what are the facilities this institute provides, we have the state-of-the-art facility when it comes to neuro. And to talk a little more with other departments, we have a 15-bedded ICU. We have the state-of-the-art operation theatres, multiple operation theatres. We have a 24 hours dialysis unit. So we realized that reports are extremely important for diagnosis. That is how we tied up with Central Lab to give this diagnosis. We have a 24 hours pharmacy, and the reason behind this is since it's a trauma center, we should have all these facilities. We have facilitated it in such a way that they could use my private luxury rooms on par with a general ward. And we didn't want to give general ward, is basically because patient could use, and we could also focus on patient equally well in terms of care. And finally, we have given a huge importance to our nursing. There's been a lot of training which has gone into my nursing staff, so that we have picked each staffs from the hotel industry just to make sure that hospitality is given the highest care in Akshaya Neuro and Multi-Speciality Hospital. Now, we also have a vision which me and Dr. Karthik in common we have shared, and we realized that to make this possible, we need to reach out to different parts of these cities in Karnataka, and finally have our presence felt throughout the country in terms of affordability, which I've primarily focused and made sure that several times I've mentioned this to patients that they should afford when they walk into an institute. Most of the times we see patients when they come here, especially patients who do not have insurance, that they literally are in trouble to raise funds when it is a head injury or some sort of trauma which runs into lakhs of rupees. So we want to make sure that a brain surgery is as probably less than a lakh, or something like that. So patients could afford it when they walk into Akshaya Neuro and Multi-Speciality Hospital, and finally they go back smiling and making sure that we give them the utmost care when they walk into my institute. So I would like to wind up saying that we are here to serve you. Thank you so much.